qualified plastic and reconstructive surgeon, Dr. Lajevardi. And today we're going to be talking about tummy tucks. A lot of your frequently asked questions over the past couple of days that you have sent in. First of all, we're going to hear a little bit more about Dr. Lajevardi. So tell us a little bit about your medical training.
Thanks, Bella. Hello, everyone. So I started my medical training in 2004, a long time ago now, about 17 years ago.
Wow.
And over the past 17 years, I've been, so once I finished my medical school, I started training towards plastic surgery by first doing general surgery and then plastic surgery. And here I am now, and I'm looking to specialize in aesthetic surgery of the breast and the body.
Okay, perfect. And so tell us a little bit about your qualifications and what's actually involved in becoming a plastic surgeon.
So I've done medical training, obviously, and I also did a Bachelor of Science in medicine as well as an honours degree. I also did a Master of Surgery, and I have a graduate diploma in anatomy, and also doing my PhD, so quite a few other degrees as well.
Mm-hmm.
But what's involved in becoming a plastic surgeon is there's a rigorous selection process and then training through the College of Surgeons. Before that, I actually did accredited general surgical training through the College of Surgeons, and then I did my accredited plastic surgery training, which is 5 years through the Royal College of Surgeons.
Okay, and I hear you're also the chairman and founding member of an international charity.
That's true. So Doctors Assisting in South Pacific Islands is a charity where we organise for surgeons to go over to the Pacific and perform surgeries, and I've been going to the Solomon Islands yearly for doing some surgical work there.
Perfect. So again, the reason we have Dr. Lajevardi here is to answer some questions about tummy tuck, because you do specialise in breast and body. So tell us exactly what is a tummy tuck.
So look, tummy tuck surgery is where we remove the skin and fat from below the belly button to increase enhance the look of the tummy and remove any extra skin or stretch marks that are there below the belly button. This is usually the case for people who've had pregnancies that has caused extra skin to be there, and there are stretch marks, and a tummy tuck removes that. The other group of patients that it's usually very beneficial in is those who've lost weight, and there's a lot of extra skin there that needs to be removed. Now at the same time, there is other things that can be achieved during a tummy tuck surgery, and one of the most important ones is repair of the muscle separation, and the medical term for that is rectus divarication, is where there has been previously stretch on those muscles. So during pregnancy, when the baby is growing, those muscles stretch, and when the baby is delivered, those muscles come back to a point, but not all the way. And that separation can be repaired during a tummy tuck. And that's really important because research has shown that repairing those muscles can improve back pain, and can also even help with urinary incontinence. So those are really important things that can be achieved during tummy tuck, as well as if there is any hernias at the same time, we can repair them.
Okay, perfect. So, a lot of people do ask about muscle separation. So you obviously perform that within the tummy tuck procedure.
Absolutely. So it's basically a standard part of a tummy tuck where we actually remove the skin from below the belly button, so from belly button to the sort of the line of the groin, and then the skin that's above the belly button is raised all the way to sort of where your chest bone starts, and we actually repair the separation of the two muscles with permanent sutures, so those are always tight, and that tightening actually also helps with giving a waistline. And then the skin that's above the belly button is pulled down, and then any extra skin from below the belly button is removed, and then I always try to keep the scar very low, so if you want to wear a bikini or hide the scar in your undies, keeping the scar low is really important.
Okay, perfect. So, a lot of people do often ask about recovery with the tummy tuck procedure because it is quite a large surgery. So when can people expect to be able to do general household tasks like picking up children or laundry or things like that?
So it's a very good question. Every tummy tuck is a little bit different. So there's different types of tummy tucks we can go through. But generally, most people expect to be in hospital for 3 to 5 nights. What's involved with a tummy tuck is that you have some drains. Now the drains come out after a few days, and sometimes they can stay longer. And once the drains come out, we'll see how much the level of your pain and mobility is. We do use a pain buster, which is a device that infuses local anesthetic to your tummy, and that keeps you comfortable. So once you're up and walking and you're recovering, the drains are coming out, then you can go home. The first 2 weeks is still sort of recovery phase, and that's the time where you can walk, you can maybe just do gentle exercise, but nothing heavy. And then over the following 4 weeks is when you're starting to recover, be able to drive, start picking up objects, and then around 6 weeks mark is when we're happy for you to, if you have children, to pick them up and go back to normal exercise. You will be having a binder that you'll be wearing as well after the surgery, and that sort of helps protect the repair of the tummy, and that's for 6 weeks as well, and that helps keep all the repair together and get you through that initial phase of recovery.
Okay, and as a general, of course, depending on physicality of work, about 2 weeks off work?
Correct, so 2 weeks is sort of the minimum. After 2 weeks, you're slowly getting back into driving, and if you just work in an office environment or you can work from home, that's when you start doing that. And then if you need to do physical things at work, then it becomes closer to 4 to 6 weeks.
Okay, perfect. So, what a lot of people don't actually know is that although Dr. Lajevardi operates in Sydney, we do have a lot of interstate clients traveling for surgery. So depending on complexity, typically clients are required to stay for about 7 nights in Sydney, is that right?
That's correct. So that's usually the sort of minimum required time. And again, if you've got a more complicated case, you might have to stay in hospital longer, and then after discharging from hospital, you might need to be in Sydney for a few extra days so you can be reviewed. So I will advise those on a case-by-case basis depending on the complexity of the case.
Sure, and how many of those nights are in hospital usually?
So again, 3 to 5 nights depending on what sort of surgery you've had. If it's just a standard abdominoplasty, so the short scar after pregnancy removal, generally on the lower range of that number of nights. But if someone's had the extended abdominoplasty, or especially a belt dipectomy where you go all the way around, that's when you're looking at maybe up to 5 nights in hospital or longer if it's more complex, and also if there's liposuction involved, recovery can be a bit longer.
Okay, perfect. And the great thing is with the pricing at CosMediTour, it is all inclusive of the hospital stay. But regarding the liposuction, a lot of people are asking if that is included in the tummy tuck procedure.
So I do liposuction pretty much in most of my patients that need an abdominoplasty. Liposuction is a great addition to abdominoplasty because abdominoplasty is removing the extra skin, but liposuction does give help to contouring, so it gives you a better waistline and can remove those sort of unwanted love handles sometimes on the side. It's not suitable for everyone, so it's again a case-by-case basis. In patients that we think it's suitable for having liposuction, we include that as well. But if they want extended liposuction or extra areas, then that needs to be discussed on an individual basis.
Okay, perfect. So, and also what a lot of people don't actually realize is that there is a number of different types of tummy tuck procedures. So tell us a little bit about the different types that we offer.
So we got a few different types of tummy tucks depending on your needs, basically. So there is one type which is like a mini tummy tuck. It's very small amount of skin removal only. The standard abdominoplasty is the one that most people have. It's when the skin below the tummy is removed, and you're going basically from hip bone to hip bone. Now, in some people, especially if they've lost weight, there is extra skin that goes to the side, and we can do an extended abdominoplasty where we actually take the scar longer. Now, you only want to use the scar, you want to keep the scar as short as you can to keep it hidden. But if you do have extra skin that's going to the side, to avoid a dog ear, we can take the scar around. Now in some patients, again in those that have lost more weight, especially if they've had bariatric surgery or through exercise and managed to lose a lot of weight, this extra skin can go all the way around. And doing a procedure called a belt lipectomy or a circumferential tummy tuck or 360 tummy tuck, a lot of names for it, or a lower body lift, we can actually take that dog ear all the way around. And then there's advantages in doing that because you actually lift the thigh on the side and you get a really nice effect from the thigh lift. And you actually also do a buttock lift because on the back you're pulling the skin up. So you're actually doing like a 360 rejuvenation with the tummy, the thigh and the sides, and the buttock and the back.
Okay, perfect. So a lot of you have been asking how to get a free quote. So if you would like a free quote with Dr. Lajevardi, you can head on to the CosMediTour Instagram and click the link and send your inquiry form through, attach your photos, and you can get a free quote. And we will assess your price and also the procedure that is required. Thank you everyone for watching, and the next video we will be talking about the different types of incisions as well for the tummy tuck procedures.